Hello and welcome. We're watching our special show, Coronavirus Facts versus Myths. I'm Gargi Rawat. Let's bring you the latest data that was released today. 30,941 fresh COVID cases have been reported in the last 24 hours, 27.9% lower than yesterday. That's what the government data has shown. 350 deaths have taken place during that period. Now, the active cases account for 1.13% of the overall cases, and the active caseload is currently at 3,70,640. The ICMR's head of epidemiology and communicable diseases has said that some states which did not face an intense second wave of the COVID pandemic are now seeing an increasing trend of COVID cases, showing early signs of the third wave.
कुछ स्टेट्स में जिधर आंकड़ा हमें देखने को मिलता है कि ऊंचाई की तरफ जा रहा है, बढ़ता जा रहा है, वो सारे स्टेट्स में सेकंड वेव इतना इंटेंस तरीका से नहीं आ चुका। तो ये जानकारी अभी जरूरी है, ये समझना भी बहुत जरूरी है कि इंडिया का बात हम ना करें, रादर स्टेट स्पेसिफिक बात करें, क्योंकि जब सेकंड वेव और दूसरी लहर जिसको हम कहते हैं सार्स-CoV इन्फेक्शन का इंडिया में आ चुका था, 10 states contributed 80% of the infection. तो बाकी सारे जो स्टेट्स हैं उन्होंने दिल्ली और महाराष्ट्र को देख के जल्द से जल्द रेस्ट्रिक्टिव मेजर्स लगा लिया।
Now, the big focus on the show today, a study that was released recently, a preprint study that shows a high rate of breakthrough infections in vaccinated healthcare workers. This preliminary study involved healthcare workers at the Max group of hospitals in Delhi and Gurugram. It was led by scientists at the CSIR-Institute of Genomics and Integrative Biology, and it found that a little over 25% of the fully vaccinated healthcare workers contracted the fresh or breakthrough infection, and it was the Delta variant, but none of the nearly 600 vaccine recipients who were actually a part of this study required any hospitalization. So that's some good news. Well, to talk more about this study, we're joined by Dr. Sujit Jha, Principal Director, Endocrinology and Diabetes at Max Healthcare, who was a part of this study. Doctor, I think it's best that you take us, through the findings of this study. Some of the points that the study makes is that there are a high number of breakthrough cases. 25% was found among the people who had not been previously infected with COVID but had received both doses of the vaccine. A lower number of breakthrough infections were found among those who had been previously infected with COVID and received the vaccines.
Thanks, Kagi, and I must thank IGRA for tremendous support that they provided, and obviously Max Healthcare. We could do this study in the middle of the pandemic. These are very logistical challenges to collect blood. We're healthcare workers. We're also working and trying to collect blood. So thanks to all my colleagues, friends who could support us on this study. We almost picked up 900, but we could collect the final data of approximately 600 people. And if you look at to divide, and I'm rounding off the number, 50% were previously infected and 50% were not infected. And if you look at overall, what we found that 25% of the people after the first vaccination got Delta variant, which we could see by doing the antibodies. Must say, we didn't do an RT-PCR. But looking at the different variable antibodies response, which tends to happen with infection and with Covishield, we could see that 25% of the people, almost like 140 of the people, got Delta variant. Approximately 12-13% got Delta vaccine even after second dose. Now, if you look at who are those 25%, these are majority coming from not previously infected group. So what this study tells you and me is that those who have been previously infected had first dose and the second dose, they are really well off. Those who were not previously infected had first dose and second dose are really good. But are we 100% protected from the Delta? The answer is no. And it's very difficult. How do you know, Gagi? Even I had no idea that I was previously infected because I was a healthcare worker and I had antibodies negative. I had no idea I was infected. So any individual, we should not try to do any antibodies before and after and trying to utilize this in the vaccination study. This is more for the gentleman who came earlier, ICMR, to understand this data, that what we came out through. So what it tells us, coming from the Israeli learning, that look, Yes, please get yourself vaccinated. Don't care you have been previously infected or not. Get your first and second vaccination and continue COVID appropriate behavior in spite of you have been vaccinated, fully vaccinated second.
Right, absolutely, Doctor. So, few points. This study was conducted on healthcare workers. So, there obviously are, people who are more exposed, more vulnerable, because of that exposure. So, in that sense, the study subjects are different compared to like a normal person who's not as exposed. Also, yes, an important point about wearing masks. I think this is where the United States went wrong when, they removed the mask mandate very early, and then there's been a lot of confusion. And of course, in the southern states, a lot of protests against masks. But the importance of continuing these protocols even once you're vaccinated, because you could be carrying the virus and could pass it on.
I completely agree, Gagi. I can tell you, and just my assumption that even if you have done an NDTV staff at the second or the middle of the pandemic, almost similar remote are positive. So there's no difference between the healthcare worker and you and me now. The way unfortunate second wave, it's got affected. So more or less, this is a reflection of what would have happened. I agree that healthcare worker have a positive, but when it comes to Delhi, as ICMR is saying, India is a huge continent. Like somewhere like Delhi, we had almost similar prevalence of infection before we got vaccinated. And I completely agree with you. I've worked in majority part of the world, Western world. I can tell you, India is one of the countries which will not have protest. We are very good in wearing masks. We are good in wearing dupattas. We are good in risking headscarf. We don't have any issues of covering our face. We are very civilized. We do understand that we can do it. And we don't have issues wearing a mask. We're culturally very different. We do cover our faces. We do put the dupattas. Right. We do this. So what? Putting a mask, it adds an extra layer of clothes. So what? And I particularly think that India would succeed in this compared to certain states of the United States compared to what we are as a country.
Right, and what the ICMR has said about certain states which weren't so affected by the second wave of the pandemic, and we do have these sero surveys as well, which shows us which populations were affected more, and now we're finding out the extent that the COVID pandemic went through people during the second phase of second wave of coronavirus. So now they're saying that in some states which they're seeing a certain increase in the numbers, and this could be the early signs of a third wave. A lot of talk has happened about the third wave, and your study also shows that variants and the breakthrough effect that they can have even after vaccines.
That's correct. To see that you should have a second wave. I'm sure I'll pray to the God. Let's hope that nowhere in this country or the world should have third wave. But we had a huge assault to Delhi and Mumbai and major part of the country. It's a very expensive way of getting an immunity. Like the part of the Kerala which behaved very well had a lower seropositivity, which is well known. Now they are the one states that they may go for the third wave because they had a milder second wave. But ultimately what we should as a country is doing, and now countries understand the problem. We should vaccinate, and do the same. Even if you're not vaccinated or vaccinated, COVID appropriate behavior. And government, at some point, some strategy should change, that once we are enriched with the vaccine that what we have, we start thinking of mRNA vaccine, mix and match vaccine. I'm not recommending. Large number of scientists need to sit down and understand that how can we do, later part of the vaccination process. And obviously, if we can identify those people who have been previously infected, we can get first vaccinations and put wider vaccination process across the country, so the ICMR can learn and sure. Niti Aayog can learn from this study as well.
Right, and Dr. Jha, briefly, in the end, I want to ask you right now, in a lot of other countries like the US and Israel, there's all the focus is now on a third dose of the vaccine, a booster dose. Right now in India, of course, the focus is on getting as many people vaccinated. But your view on the need going into the future of a booster dose?
I will not claim to be expert of this, but sure. I would say that my knowledge says that, look, we have not reached that stage. Let's focus on what we have planned, which is vaccinate everyone second fully vaccinated, and COVID appropriate behavior, which is hand washing and mask. For the time being, let's stick to that strategy rather than diverting towards third booster dose mRNA, which will be a big task for a country like us. Let's finish the task at what we have thought we should do it, and we are doing it fairly, in a right pace now.
All right. Well, thank you so much, Dr. Sujit Jha, for speaking to us here at NDTV.
Thanks, Kari. Thank you.
Now, the second focus on the show today, a look at news of variants that are emerging in different parts of the world. Now, a variant of interest, C.1.2, was detected in South Africa earlier and now in many other countries as well. And a new study has found that this variant could be more transmissible and evade protection provided by vaccines. So, a worry there. And a new sublineage of the Delta variant known as AY1.12 has been detected in some states in India and in Israel as well. In fact, it's seen that this variant of the Delta variant is something that is pushing the surge in cases in Israel. And now there's news from the UK where there fears that after a big music festival gathering that took place there, it could have led to the emergence of a new Delta strain, and that's being investigated as infection has spread among those who attended this music festival. Well, to talk more about all this, we're joined by Professor Dipti Gurdasani, Senior Lecturer, Queen Mary University of London. Thank you so much for joining us. And Professor, if you could talk firstly about this news. I think it's just come in one or two places about this music festival where over 50,000 people attended, and now it's being found that a lot of them have been infected with what could possibly be a new variant of the Delta variant.
So we have heard this from some news outlets, but our public health body, which is Public Health England, hasn't confirmed this. So we need to sort of wait on reports for that. Having said that, we've had several new mutations emerge on a background of Delta. So Delta is constantly evolving when there's transmission. We've had pretty high transmission in England for long periods of time. And we have seen several new mutations emerge, several different strains. So we have 12 strains or sublineages of Delta within the UK, which are being monitored. And we haven't noticed any particular one, increase in frequency in a sort of consistent way, like, for example, Israel has reported. But it's something that's being monitored at the moment. But we need to remember these viruses, if they allow to transmit, are constantly evolving. There are concerning mutations that are developing on this background. And as we see with the C.1.2 sublineage, many of these mutations are the same mutations that have been associated either with increased transmissibility in other strains or escape from vaccines or immunity in other strains. So we have to keep an eye on this. And as long as we allow the virus to evolve through transmission, we will see new variants emerging. The only way to stop this is actually to control transmission.
Right, Professor. Earlier at the start of the pandemic, we all talked about herd immunity, and if we cover 60 to 80% of the population with the vaccine, the COVID will stop circulating, and that's how we'll get out of this pandemic. But now we do know that even those who are vaccinated do get infected, they do pass on that infection. So what is our understanding now of herd immunity, and the focus still remains on vaccinating as fast as we can?
So the Delta variant has changed our understanding of herd immunity, because we know that vaccines that were developed against previous variants, while they're effective in preventing serious illness with Delta, they don't have the same level of protection against people getting infected and transmitting. So that means developing herd immunity through vaccination, even if we vaccinate 100% of the population, is unlikely. But that doesn't mean it doesn't help. It certainly reduces transmission, but herd immunity may not be reached, which means that vaccination alone might not get us to a point where if we lift all restrictions and mitigations, the virus won't start rising again. It probably will. And the answer to that is, while we wait for new vaccines to be developed that are more effective against Delta, we need to control new variants emerging, but we also need to mitigate. So we need to think about improving ventilation in indoor environments, in schools, in workplaces, in shops and businesses. We need to continue with our mask wearing, social distancing, and we need to think about vaccination alongside mitigation. Vaccination alone is not enough to contain the pandemic, although it's really, really important. This is a virus that's transmitted through the air, like cigarette smoke, and we need to use all the measures that would stop that, like ventilation masks. The more layers, the better we can control this.
No, absolutely. And, this example from England, it just proves that, because on one hand, you have very good vaccination rates over there, and, a significant proportion of your population is vaccinated. But at the same time, if you hold some, big music event with over 50,000 people, clearly that's a recipe for disaster.
Absolutely. The Delta variant is highly transmissible. We think that if this was spreading in a non-immune population, unvaccinated, not exposed to infection, one person could infect 6 people, and that's a lot. Because we have high levels of vaccination, that's reduced, but it's not reduced to the point that we can have large gatherings and hope they won't be spread. They will be spread, because crowded environments is exactly how this virus super spreads, when people socialize and meet each other without masks, without ventilation. So we can't forget about mitigations as we vaccinate, and we need to think public health is always a combination of things, and vaccines are part of it, but not the whole picture.
And what do we know about this variant? If you could just tell us a bit more, in a bit more detail, this C.1.2, the studies found it could be more infectious, that it could evade vaccines more, and a little bit about how these variants emerge as the virus circulates among the population. It just gets better and better at infecting us. Well,
so every virus randomly mutates as it transmits from a person to other and as it replicates. So most of the mutations will not have any impact on the virus, but obviously the mutations that allow a virus to transmit more over time increase in the population simply because they are better transmitted. Similarly, mutations that escape immune response or vaccine also become more dominant over time as more of the population is immune, because they just make the virus more fit. And that's what we see with all variants that emerge, that all of them develop the same sort of mutations, the ones that are associated with more transmissibility or better escape. The C.1.2 mutation was first detected in South Africa and is sort of a sublineage of the C.1, but it's quite diverged or different from the original strain of the virus. We don't know right now whether it's more transmissible or more able to escape, but we know that it has mutations that are common with alpha, beta, delta, and gamma. And we know that these mutations in other variants have been associated with higher transmission escape. I think the South African scientists are working on this urgently to determine whether this combination of mutations in C.1.2 will also have the same effect, whether it will be more resistant to antibodies or more transmissible. I think what they've noticed so far is that the frequency of the variant, although it's still very low, it was 2% in July, I think, has been slowly increasing in South Africa, which is obviously a concerning trend. But I think we will have to follow that closely to see if it does continue to increase and if we do find that it's more transmissible or more likely to escape.
And looking forward, if you can just tell us, does this mean that we'll have to just keep vaccinating and getting new vaccines to deal with the new variants, and till finally the virus becomes endemic perhaps in various countries?
I hope we won't have to do that. I mean, unfortunately, when I look at the global strategy on this, it looks like that's where we are headed to. But I think we need to remember a new variant emerging can massively change the trajectory of the pandemic. I mean, Delta massively changed this. Not only did it lead to mass death and infection in many parts of the world, including India, but it made attainment of herd immunity very difficult or impossible just with vaccines that were not directed towards it. So we cannot afford to have new variants emerging like this. So we have to actively prevent it by containing transmission. So it's not just focusing on deaths and hospitalizations. We need to actually reduce cases, which, as I said, we can't do through vaccines alone. So I think we need to sort of adopt a global elimination strategy where countries really try and get to zero COVID. And many countries have. Countries with the population density and even population of India have done this. But we need governments and politicians to understand that this is not a virus we can live with, because it keeps mutating and becoming more transmissible, more severe, and evading vaccines. So we have to prevent new variants emerging. And the only way to do that is changing the way we live with ventilation, masks, and vaccination, and global vaccine equity.
All right. Well, thank you so much, Professor, for joining us on the program.
Thanks for having me.
Thank you.